Watson Clinic is a physician-owned, multi-specialty clinic with over 350 physicians and providers, more than 40 medical and surgical specialties, and multiple locations across Polk, Pasco, and Hillsborough counties in Central Florida. For more information, visit watsonclinic.com. Thank you for tuning in to another episode of Watson Clinic Health Talk. I'm Jamie Duvall, a content strategist in the Watson Clinic Marketing Communications and Media Relations Department. Watson Clinic operates 3 walk-in care facilities: Urgent Care Main, Urgent Care South, and Express Care Highlands. For more information on these options, visit watsonclinic.com/walk-in. On this episode, we speak with Dr. Jarett Gregory. He's an urgent care specialist who treats patients from our Urgent Care South location at 1033 North Parkway Frontage Road behind the Oak Bridge Center Target in South Lakeland. During this conversation, Dr. Gregory and I discuss the benefits of seeking treatment at an urgent care facility as opposed to a traditional emergency room, the many injuries and illnesses they can address, and the factors that set Watson Clinic apart in the urgent care field. Thank you, Dr. Gregory, for coming in and sharing time with us today.
Glad to be here. Thanks for having me.
So urgent care, just from my observation, in recent years it seems to have really increased in popularity, just as a service. So I'm wondering what you attribute that popularity to.
Well, I think a great deal of that comes from this lifestyle that people have these days. They're used to that on-demand service, maybe from recent advances in technology. Clearly, people are busier. Their schedules are packed with family activities, work responsibilities, and having something like an urgent care that's on-demand healthcare service is incredibly attractive. You see people kind of doing variations on a theme of telehealth medicine, ambulatory services, urgent care, emergency medicine. I think the draw of urgent care, the way Watson Clinic does it, allows the patient to have accessibility to CAT scanner, ultrasound, x-ray, full laboratory services, hydration. That is not the typical urgent care across the country. And that's one thing that we get feedback from people who visit Central Florida. We have these world-class theme parks and attractions, and people kind of find their way through Lakeland, and they'll stop off at an urgent care for things that may occur. Swimming in the resort pool, they get an otitis externa, they get cough, colds, various and sundry infections. They stop in, and one of the common responses that we get from people, wow, this looks like a hospital. Okay, we get that. It's not. we understand what you're saying. We have what we call ancillary services, the things that I just mentioned, the CAT scanner, the x-rays and ultrasound, and et cetera. A lot of urgent care facilities, they do smaller scale provisions and services to patients. For Central Florida, having access to Watson Clinic and the way that we've elected to do urgent care, it's such a strong alternative to going to an emergency room. You know, when you go to the ER, you don't know the wait time necessarily. There's certainly a higher level of acuity and trauma going on, and your abdominal pain or chest discomfort or laceration may not be at the top of the list for what's happening in that department. And those are the kinds of things that we want to try to segue away from the emergency room and bring it to the urgent care so that the emergency room has the ability to focus on that higher acuity trauma. Those scenarios allow them to focus and do that well, and sort of keep the smaller to mid-level unexpected things that can occur in life in the urgent care department.
Yeah. What are some of the most common conditions that people previously had gone to the ER to treat that can actually be handled much more efficiently at an urgent care facility?
That's a good question, because I know I get that question a lot with folks. What can you not do? So lacerations, cuts, bruises, broken bones, you can bring that to the urgent care. Abdominal pain, some chest tightness or discomfort, we can take care of that at the urgent care. If you've got electrolyte issues, dehydration, we can take care with electrolyte replacement, sodium replacement, potassium replacement, magnesium, etc. We can do those things because of the way we were built to provide the equipment to do those. And so a lot of people sometimes aren't clear, where do they go? Is this an ER issue or an urgent care issue? And I would say the safest thing for you to do is to call the urgent care or to look online where we sort of spell out, here are the list of services that we readily can take care of and provide care for you. Certainly, if there's a question, if you think you're having an active heart attack, you've had a history of cardiac events, perhaps you're better served in the emergency room. However, if you've got a fairly benign history, you've got some chest discomfort, you don't have a strong family history, those are the kinds of things that we can take care of with some evaluation in the urgent care setting. And so it's nice that you have a landing pad in the urgent care so that you can get those things taken care of without going into an emergency department setting.
And it's ages 2 and up, right?
That's right.
Okay.
So ages 2 and up, we take care of at all 3 locations. The urgent care on the north side of town, we are urgent care south over in the Oak Bridge area, and then there's express care, which is out on 540 location. Ages 2 and up, and pretty much the hours are 8 a.m. to 6 p.m. 7 days a week, which really can capture a lot of what happens school days, work days, Saturdays and Sundays, when things tend to happen on our, what we call the weekend warriors, the guys who work Monday through Friday, and on Saturday, they're an athlete. So they're going to go play softball, basketball, etc. And then, they kind of break an ankle or twist a joint, sprain. Come on over. We can get imaging done at the same time, get a report and take care of what needs to be taken care of that day.
Yeah, and I think there might be a misunderstanding that about who will care for you when you go to an urgent care as opposed to an ER. Our urgent care facilities are fully staffed by board-certified physicians and
that's an excellent
highly
point.
trained care teams.
Right. So a lot of chain healthcare facilities do different approaches to urgent care or express care, or I've heard them called different things, but essentially ambulatory care settings. Watson has board-certified physicians, internal medicine trained, myself, pediatrician, internal medicine, family medicine trained, emergency medicine trained, physicians who are always physically present in the department. We certainly are proud and very grateful to have a couple of mid-levels at some of the locations, but those mid-levels are never left unattended by supervising physicians. In case something comes up that they need help with, they have immediate access to a physician.
Yeah, exactly. It's just the convenience, because it really does feel like, and maybe this is not accurate, but it feels like the bridge between a primary care and an emergency room setting.
Exactly right.
And so just the convenience of that and the availability 7 days a week during extended hours. You don't need an appointment. You just walk in.
Right.
You walk in and walk out and you're taken care of.
It's very attractive. It's very convenient, and it's really quite a luxury of a service for things to come up, and you have a place where you can obtain immediate evaluation, imaging, diagnostic testing without an appointment, because life happens and you don't always have time to make an appointment, wait for the appointment, go to the appointment, wait in the waiting room. That can be a very unattractive feature. However, when things pop up, you walk into urgent care south, we get you checked in, see the doc, get taken care of what you need, and you're on your way. A lot of people seem to find their way into urgent care south when they are on their way to the airport, or we've got a cruise and we've got to be at,
it's a last minute
last minute kind of thing. And, I think back to the few years ago, we were having to screen people would need a COVID test or some type of testing before they could board ship for their cruise. And we'd see people kind of with, bags in hand, ready to go on that trip. We'd have to take a look and say, you've tested positive, so we're going to have to rethink a few of these travel plans. But you have a place where you can walk in and get that taken care of. And that's really very, very fortunate. It's nice to be able to fit that niche in healthcare because people do kind of get into a bind and they need, hey, we're going out of town unexpectedly and I've got to get a quick refill on something. We can bridge that until you get back into with your family doctor. You're going to be out for 6 or 7 days. You're going to run out of medicine. Listen, we want you to be totally taken care of. So we're going to make sure that you get what you need. We'll supply that gap. And then you get back in with your family doc as soon as you get back. That way you're not without while you're traveling.
Right. And you mentioned it earlier. If you walk in or hobble in with an injury.
Sometimes.
We have radiology on site, so we can do imaging and we can determine the nature of your injury.
You're right.
If you come in with an illness, we have a lab on site. We can draw the blood and test it right there.
And that's the commitment. I think Watson Clinic decided this is how we're going to do urgent care medicine. From a historical perspective, I think it was the late 90s. The first urgent care Watson had was at the Oak Bridge, the South Campus, where we are now. It was Dr. Bavinger. I think there were 2 or 3 exam rooms. But Watson Clinic was already trying to get ahead of the curve and say, there's a growing trend here that people want on-demand services. They want to have quick accessibility for life's unexpected adventures that may kind of come their way. And then we developed the urgent care on the north, on the main campus, expanded that ultimately, and then built the 540 Express Care, and then just in 2020 opened up Urgent Care South. And certainly it has served a growing flavor of medicine to provide quick, accessible, high-quality standard. And that's always been Watson's commitment. Not just we're going to build it and we're going to be the same as everyone else. We're going to build it with the intent of doing it better than what other people have done. We're going to study what they've done and we're going to find ways to improve on it. And I think that's what keeps us growing and that's what keeps us kind of ahead of the general market and competition, is that there's a serious commitment to being better than our, competitors.
It's a wonderful concept, and it clearly serves a need in the community. But you, as an urgent care physician, you have to know about a lot of things. I mean, I would imagine not many conditions come in that are a stranger to you.
It's a variety. And so when you are serving in medicine as an urgent care physician, your day could extend anywhere from a UTI to a brain aneurysm, to a new cancer diagnosis, to a laceration, to a myocardial infarction, to an ear infection. It's a large, vast array of issues that come in. And we're really lucky. At Urgent Care South, we've got Dr. Patty Smedeke, family medicine, done urgent care for a long time, highly competitive in the athletic world, just completed Kona in Hawaii last year, did very well in her division. We've got Dr. Alan Wells, who did a tour in Afghanistan, excellent emergency medicine trained physician who patients just love. And then our newest addition, Dr. Karen Shabreyer, who we recruited from the West Coast, from California. She was with the group Palo Alto out there. She was awarded earlier in her career a medal for performing surgical procedure at sea during storm. And so you've got to have the kind of providers that can handle complexity and then shift gears into the 3-year-old who comes in with an earache, and be able to adapt to the sensitivity of the emotional needs of that exam room. And then walk back over to one of the, active chest pain, hypertensive, elevated troponin scenarios where you want to meet the patient's needs, but simultaneously you've got to get this patient taken care of, medicine administered, transport them over to the emergency room, and we make a phone call over to the ER while the patient's en route. And we'll say, hey, I want you guys to know this is kind of coming your way. Here's what's happening. Here's what we've done, so that we sew that gap pretty tight from leaving, location A to go into location B. They understand we've given this medication. Certainly when the paramedics or EMTs, when they arrive, transport team. We give them the report, and we give them a printout, and it says, here's the patient, their diagnosis, here are the medications that have already been given, and a copy of all the labs that we've done thus far. We don't want there to be a gap when they go over into the emergency room. We want them to be able to pick up right where we left off. That saves them time and precious tissue so that there's less damage to the heart. Same case if someone walks in and they've had a sudden onset of, left facial drooping. Never had this before, and they're pretty nervous. We have trained our security and front desk to keep your antennas high. If you see someone and they're concerned about that, we immediately take them into the exam room and get a couple of diagnostic tests. And with 20 minutes or less, we can have them in transport over to the emergency department at the local hospital. It's about being prepared and anticipating needs without delaying care, because time is valuable to the success of that patient.
You told us some of the background of some of your colleagues. What about you? What brought you to this field of medicine?
So I'm double boarded internal medicine, pediatrics, and I did sports medicine for a brief time. My initial goal was to work in an outpatient setting. I had this nice little 8 to 4 days a week job planned that I had pictured in my mind, and was about to sign that contract in Louisville, Kentucky, where we're from. And Watson Clinic gave me a phone call, and I listened very politely to the recruiter at that time. That was Sharon Paul. And she was incredible, and I listened. She's just a very likable person. And I said, I appreciate it. No, thank you. We're just going to stay here. We're okay. She said, well, I want you to think about it. I want you to consider it. I think that you would be a good addition. I said, it's very flattering. Have a nice day. We kind of went back and forth a couple of phone calls. Finally, on the third phone call, I said, okay, we're going to come down. We're going to come down and check it out. When I got here and realized the size of Watson Clinic, it was a mind changer for me. Once I saw the commitment that this clinic had made since 1941, how to do healthcare and do it well, that was the game changer for me. I thought, so if I need help, there is a cardiologist, a pulmonologist, nephrologist, oncologist, general surgeon. I have this whole extensive branch of healthcare when I need it, even if it's a quick phone call or a text to one of my radiology friends or an email, hey, I really would like you to see this person a little sooner. Do you mind getting them in? Sure. Send them over. We'll see them tomorrow. That kind of arrangement is incredibly rare in today's healthcare platform. And Watson has done that and preserved that amiable network among providers. And I think when we show most potential recruits that setup, it's impressive. It grabs their attention, and it helps them to understand you're not coming here to practice a solo practice. You're coming to be a part of a bigger healthcare network in a way that will help you be successful, but also you're going to be supported. You're going to have these other disciplines of medicine readily available if and when you need it. There's a lab service. There's a radiological department. There's all of the 40 subspecialties in Watson? That just doesn't happen. That's a direct, we want to grow this department. We want to grow that discipline. We want to expand that service and keep it viable. That many subspecialties up, viable, and running successfully, it's a very deliberate organization and commitment to success to maintain those. And when I saw that, I thought, this is a rare arrangement. Having talked to colleagues that I went to medical school and residency with, they are always taken back when I say, well, I just sent them over to cardiology, and they met with them and they're like, what do you mean you just sent them over? I was, well, we found something in the urgent care that was concerning, and I called and they just saw them the same day. Well, yeah, you can do that? And I say, you can't? And they're like, no, it takes weeks to get people in. I'm like, that's not the way we want to do it. We don't see it. And not every single issue has to be done the same day. So I don't mean to imply that every day we are seeing same day appointments. But there are instances that require some quicker evaluation, and it can make the difference in outcome.
Yeah, and that is the whole benefit of letting people know our size and our scope. All of their needs can be met under one network of clinics. That's the idea. And when you get care from one doctor, you're really supported by all of our other doctors too, because whatever your needs are, we're talking about fast referrals. We're talking about an electronic medical record system that follows you wherever you go in the clinic. So whatever new doctor you see, they're informed about your history. There's great benefit in our longevity and our size.
I think that's also one of the big reasons that we've maintained our relevance in healthcare industry, because we see the benefit and we hear from the patients when they say, I'm able to go to one umbrella of what's in clinic, and under that I get pediatric, ophthalmology, oncology, pulmonology. It's all included, and it's nice that when I go there, they access my one record and they see everything in one location. Of every provider has provided their information and their notes readily. And that's valuable as a provider, that I can look and see, well, what are they working on with you at your pulmonologist? And when you went to the GI doc a few months ago and they did a scope, okay, I see the results. That makes a difference in the way I'm going to select medication to treat you for your acute care needs. That keeps us out of trouble. That keeps the patient from unnecessary adverse effects or any drug interactions. You just started a proton pump inhibitor, so I know I'm going to avoid a couple of these things that might have otherwise been prescribed, because I have the benefit of seeing what they're doing in that other department. It's incredibly efficient level of care that results in keeping the patient safe, which is paramount, but also keeping their health care quick and efficient without unnecessary time of drugs that are just going to interfere with one another.
As an urgent care physician who's deeply embedded in the community you serve, you have to really have your finger on the pulse of what's happening health-wise in this area, what the trends are, what people are going through, what wave of flu or what have you is spreading.
You are 100% correct. I go to church in this community. I have family in the local schools, and we are in and out. We see folks and we communicate. We do have a sense, I personally kind of make it a point. How are things going? Checking in with, local community leaders. What are you seeing? What are you guys kind of talking about? I'm lucky enough to have a couple of friends who are leaders of a couple of congregations throughout Lakeland, North and South alike. What's going on in your church? What are you guys struggling with? What are you seeing? Cough, colds, flus, the occasional little blip of COVID that may kind of come into our arena. And when I hear that, I always think, am I prepared for that? Do we have the testing equipment, personal protective equipment? Do we have cleaning supplies? If we were to see another surge of coronavirus or an unexpected number of cases of influenza, are we ready from a medical standpoint to provide that care? Do the local pharmacies have the medications? Do we have the testing equipment? Do we have the reagent material? Is our lab ready to take on that responsibility? And as a response, we're at Urgent Care South, we're changing out some of our chemistry analyzers actually Friday because they're not fast enough. One of the things that we do at South is time studies, where I will randomly choose patients' check-in time and when were they ultimately discharged from the urgent care, and then follow them. When did they go to the lab? When did their labs result? When did the physician enter the room? When did the patient's prescriptions get sent to the pharmacy? And so you can kind of figure out, when you do that, you understand where there's options for improvement. Oh, it seems like we are really waiting a long time on chemistry. So you meet with, the department of the lab and you say, how do you guys feel about this equipment? Do you feel like it's really keeping up? And a lot of times by the time I assess the lag in time, the lab techs have already said, yeah, we're struggling there. So this Friday, we're taking out the chemistry analyzer, putting in something much more quick and efficient in order to produce results faster. And the reason that's significant is because a lot of times a patient cannot receive contrast for a CAT scan until we've done the chemistry. That test dictates whether they're safe or not safe to receive contrast for the study. Having a piece of equipment that's going to enhance efficiency and make that process quicker allows us to get the scan quicker, allows the radiologist to give us the read quicker, and get that patient in front of a general surgeon or a gastroenterology doc or another specialist at a higher, quicker rate of care, as opposed to what we currently have. We wait 45, 50, 60 minutes. Can we or can we not do the study that we want? And that really helps the patient to not get anxious while they wait. Sometimes when you're sitting in that exam room or the lobby of a doctor's office or an urgent care or an emergency room, your mind can really get to playing games. And you can work yourself up. You can get anxious. You can get nervous. Oh my gosh, why is it taking so long? Have they found something? And sometimes it's just the process of equipment. And so we feel like we can do a better job at shaving down a little bit of that anxiety by producing quicker results. And that's what we're going to start. It'll probably take us a few days to get it up and reliably kicking out the numbers the way we need to, but that starts Friday.
Well, this episode will post in August, so it'll be fully up and running by the time you're...
That will be exciting. By the time you hear this podcast,
yes,
we will have world-class fast chemistry analyzers at Urgent Care South.
That's so wonderful to hear, though, because you would imagine that a lot of doctors don't consider what it's like on the other side of that exam room door, the patient experience. So by you tracking these kinds of measurements, you know exactly what the patient's experiencing and how we can improve. That's essential.
Jamie, when I came to Lakeland, my wife and I, we knew no one here. We moved into our house, and I think we had a house with a pool, so my wife was obsessed with safety, still is. And so we moved in, and 20 minutes later, she had him in the car going to a swim lesson. It has been, since we arrived here, a network experience of unexpected blessing and opportunity to get to serve along local community leaders. We have met folks and gotten to know them and consider them very close friends that, 10, 12 years ago, whenever we came here, we knew no one. But because I formed these relationships with folks in the community, I do understand what their fears are, and I hear what they're worried about. And I take it as an ultimate compliment when they send a family or friend to see me, because it means they get that I am going to do the best I can for you. And if it's something outside of my scope of practice, I'm going to be the first to tell you and say, here's what's happening, and here's where you need to go to get this addressed. We're not going to leave you hanging. I'm going to try my best to understand, what do you need? I can diagnose and get you where you're supposed to be and cut out a lot of wasted time, because I'm a part of a larger organization with 40 subspecialties. And we're in a great location. We're in Central Florida. We're between Tampa, we're between Orlando, we've got Jacksonville, we've got Miami. We are not stranded. We are very fortunate that we can not only take care of it right here at Watson Clinic, but if there is something unusual, we have access to other places that we routinely can reach over and say, hey, we got a case of this. Can you help us? A friend of mine, she's a retired LPN, was traveling in Scotland a few years ago, and she had a Watson Clinic sweatshirt on. And the guy in the cab said, my mom lives in Lakeland and she goes to Watson Clinic all the time. Wow. And she was like, who would have thought that we're traveling abroad and people know who and what we do? It's kind of nice.
That's amazing.
It puts a smile on your face to understand that people, they see the brand and they associate
and it means
with
something to them.
It means something. It gives you encouragement as a provider.
Here's a last question for you. And I don't know that it can be answered, but let's give it a shot. Given, of course, accidents happen and illnesses pop up, but given the diversity of conditions you witness and you treat, what's the most common preventative action we can take to keep from suffering those illnesses, as you observe?
It's a great question. So preventative health care, there's a discipline of medicine that's developed over the last few years of just preventative health care. Eat right, meaning fresh fruits, vegetables, healthy amount of water, 64 ounces, multivitamin, adequate sleep, and easier said than done. Try to keep a balance of the stress that's in your life. It's inevitable, but stress raises cortisol levels, and the adversity of the impact that it can have on healthcare is measurable. So we try to get people to understand when stress is really starting to take a physical manifestation in your body, it's time to take some action. We want people to stay active. We want people to work out. We want people to address issues when they occur. When you have a cut, when you have a laceration, you've got about 12, 24 hours to seek medical care so that something can be done about it. Don't wait days and days leaving it open for potential infection to occur. You got to keep your immunizations up to date. You got to keep your tetanus up to date. You've got to keep those mammograms, colonoscopies. You got to see your family doctor once a year. You got to chat with these guys. So what we see are those unexpected life's little oops, if you will: cough, colds, UTIs, bellies, hearts, chest pains, lacerations, broken bones, head injuries. We can do it. But you have to have some skin in the game, and that means that you're actively exercising, eating well, managing your stress, staying mentally healthy as well as physically healthy. And I think that minimizes some of the events that can sometimes come into our lives and reduce the unexpected adverse healthcare needs that you might encounter.
And it really is so simple. The process of going to an urgent care to get this taken care of. So like you said, if you do suffer a cut or something similar to that, don't wait, because it's really a non-hassle experience.
It's pretty simple. You walk in, we've got some of the sweetest ladies at the front reception desk, very strong triage group of folks. And then, we're lucky. We usually have a couple of RNs, a couple of LPNs, some wonderful medical assistant, radiology technologist, lab techs, and there's at least 2, sometimes we'll run with 3 physicians on the floor in order to kind of keep patients' wait time at a minimum. We don't want a lot of folks sitting out there waiting unnecessarily. And Urgent Care South has a division. We have a well waiting area for those who may have a skin abrasion, a broken bone, a laceration. And then there's a little waiting area for, hey, I've got a cough, a cold, or some type of suspected infection. We're going to try and keep you from getting others infected. And I don't know if you've been out to South recently, but we have a really strong cleaning crew. You'll see them in the waiting area, cleaning, steaming, wiping down, sanitizing, keeping that constant level of hospital grade cleanliness, thorough, sanitary environment. Because we want you to know when you walk in, 1, it is safe, it's professional, it's clean, and you're at a place that's going to take excellent care of you.
I love urgent care. I do.
Thanks.
And thank you so much. Let's do it again sometime.
Appreciate it. Thanks for your time.
Thanks for joining us for this episode of Watson Clinic Health Talk. Make sure you visit our website at watsonclinic.com/walk-in for more information on our walk-in care facilities. And while you're there, surf over to watsonclinic.com/podcast to hear additional episodes and to subscribe to our show for free wherever you get your podcasts.